this is the graduating classes, recent graduating classes.
Oh, yeah.
I think they currently accept about 100 and so 100 plus. Teachers. I think it's around 150, something like that.
Okay. Sorry.
So we have all the different medical schools, all the different medical profession schools here. Graduate school, basic science research, we have the dental school, that way.
Oh, okay.
Nursing school, school of health and other professions, dental hygienists, medical records people. So it's a big campus. Nitrous, which is laughing gas. We have, these are all anesthesia gases. This is what keeps you asleep, basically.
Oh, okay.
So initially you'll get an IV in the pre-op area, and then we'll give you some medicines to put you to sleep. But in order to keep you asleep, we use our anesthesia gases. Because the IV medications wear off.
Oh, okay.
And so this is the what we call a breathing machine, basically. When you're under anesthesia, this breathes for you, basically. It gives you so many breaths. And so this is we have monitors. We can look at your blood oxygenation, your heart rate, your blood pressure, your temperature, making sure everything's stable as they do the surgery, whatever surgery they're doing, orthopedics or ear, nose, and throat stuff, whatever they're doing. So this is kind of our workstation, So we have oxygen, we have nitrous, anesthesia. These are a little bit stronger. And the monitors, to keep everybody safe. The pulse oximetry, which is for oxygen levels in your blood. EKG, making sure you're not having a heart attack or anything like that. We'll watch your blood pressure. We'll watch your temperature, making sure everything's good. And so that's basically.
People.
Naisha is in high school, senior in college. She wants to hopefully be an anesthesiologist. Oh, senior in high school.
Senior in high school. What do you want to do when you grow up?
See?
Anesthesiologist. What about this one?
I'm the mother.
Oh my gosh, that mother looks good.
Thank you.
Hear me when I tell you, your mama looks good.
My name is Naisha, and I'm here with Dr. Wu, who is an anesthesiologist at the University Medical Center. And we're just going to be going over a few questions. Was this your first career choice?
Actually, I was a pharmacist. Worked 3 years prior to coming to medical school, prior to going into medical school. So I actually had an uncle who was a pharmacist, and kind of when I went to college, that was kind of my first choice. But when I graduated, I worked here at the medical center and worked with a lot of medical students, and that's where I kind of changed my mind and went into medicine. And when I graduated medical school, I was looking for a residency, and anesthesia deals a lot with pharmacology and physiology, and that's what a lot of pharmacy, my pharmacy background was kind of a natural gravitation toward anesthesia. So.
Okay. What would you say is the most challenging part of your job?
Most challenging part, I guess, would be trying to balance home life. I have 2 kids with my professional job. It does require a lot of hours here. You never know what time I'm getting. I know I'm going home at least, being an anesthesiologist, but I just don't know what time I'm getting home. It could be 5 o'clock, it could be 6 o'clock, but at least I know I'm going home by 6 or 7. So that's probably the most challenging, trying to balance home life with my professional.
Okay. Do you regret your decisions to embark on this career?
No. I kind of did the roundabout. I started as a pharmacist the long way, but at the time it was pretty. I was questioning myself, but right now I love what I do. I get to help a lot of people. I'm at the academic medical center, so I get to work with the smartest people in the world, and I get to work with them, and I get to learn from them. And so I don't regret anything.
Okay. What do you enjoy most about your job?
Just getting to work with the people here. We work with a lot of nurses, nurse anesthesia personnel, the residents. They are always, asking questions, making me ask questions, and keeping me making me keep on my toes, and so that's the best part is just getting to work with a lot of motivated people here.
What has been your most positive outcome and why?
Guess working with, well, being at the medical center, we're a level 1 trauma center. We get to see a lot of sick people, transplants, heart transplants. I did those as a resident, but I guess most gratifying one, most positive is, you get to help a lot of people, gunshot wounds and things like that. And you get to, some of them don't make it, but a lot do. And knowing that you had a little part in their recovery, it's pretty gratifying.
As far as school goes, did you ever feel like it took too long?
Oh yes, it did feel like it a couple of times, but when you look back, it's such a small window of your life when you look at it, but at the time it did feel kind of long. The worst year I think in medical school is that first year, just trying to get used to it, and I set out for 3 years working as a pharmacist, and trying to get back into the studying mode, and the routine of studying is the hardest part. I think the first year is just, for me, if you go straight in, I think a lot of people are a little bit more used to the routine, whereas it took me a little while to get back into the swing of things.
Okay. As a young aspiring anesthesiologist, what helpful recommendations would you give me?
I think doing the course that you're doing now, going to college, biochemistry is a great profession, or a great field to go into. Just keep your mind open. There's a lot of opportunities out there. Anesthesia's great too, but there's surgery. Just do what you love, and it won't feel long.
Okay. Well, you just answered that question, but it was, I plan to attend Alcorn State University and major in biochemistry, and after graduation, I plan to further my education at the University Medical Center, where I plan to study and become an anesthesiologist. Do you think that this is a good plan?
Yes,
Alright.
great plan.
Just 2 more questions. How much education do you think is necessary for this career?
Well, you'll do 4 years of medical school, 4 years of residency, and if you choose to specialize, it's just another year, whether you do pain or pediatrics or OB or cardiothoracic or cardiac anesthesia. I think those are just about right. I really think it's where you practice is where you're going to get your most. You're going to learn your first year out is where you're going to learn the most, basically. So I think those, no matter how much school you have, you still got to get out that first year. It's going to be a big learning curve. You'll learn a lot. So, but I think definitely those are adequate training all those years. That's a lot of years. So.
Okay. And last question. Is it difficult to get into this career?
I mean, you just gotta have persistence. It's medical school. Get through medical school. It's a race. It's a marathon, not a sprint.
Okay.
A lot of people will burn out if they, that's all they do is study. So just keep yourself well-rounded, and school first, but you gotta also have time for family. Make sure you take care of yourself too. So it's definitely an achievable goal. If I can do it, anybody can do it.
Okay.
So,
All right. Well, that's all of my questions. Did you have anything else you want to touch on that I missed?
another word of advice would be, you're gonna always have people that tell you you can't do it.
Yes, sir.
That should just be more motivation for you.
Yes, sir.
Even I've had people that tell me, you gotta do this. So, don't listen to them. Just do the best you can. Keep your family, and keep close to your family. That's the people you're gonna depend on. You need them the most. So, there are always gonna be negative people. Just use that as your motivation. So, I hope that helps.
Well, thank you for your
Yeah.
time.
Well, good luck.
For the chose a better person to interview.
So nice to meet y'all.
So nice.